You're not in trouble.
I know that.
I know, but it's just something we got to say. So, all right.
You all right?
Mm-hmm.
Haley?
We were talking about some other things.
Okay.
So it has nothing to do with this.
Okay.
I had some problems with some people on the floor, so.
Gotcha.
Yeah. There's always something.
It's always that way.
There's always something.
Part of being human, right?
And that's part of being in the hospital.
There's that. So, Mr. Halliday,
Yes, sir.
can you just, from...
Tell us your name.
My name is, I go by HT, but my name is Hilliard Truman Halliday. I'm a licensed RN in the state of Oregon and a multi-state compact license throughout the United States.
And how long you been an RN?
10 years.
10 years. And you live here in Artesia?
I live in Hagerman.
You live in Hagerman?
Mm-hmm.
Okay.
I've worked here. I've worked in Ruidoso. I've worked in Tucson at Northwest Medical Center, Oro Valley. They also have a standalone marina, standalone ER, and I also worked at Bay City Area Hospital in Coos Bay, Oregon.
Oh, wow. Okay.
So you've traveled.
Mm-hmm.
All right. So I know you already told me before, but can you just, from the beginning of your contact with either the mother or the child, can you tell us from the beginning to the end everything that you have had, that you witnessed?
Well, I was the charge nurse in
Okay.
the ER that night.
And what is the charge nurse?
Charge nurse is responsible for the overall running of everything that goes on. Any problems or any issues or anything that needs to be dealt with as far as just about anything, you take care of that. Okay, you're in charge of the whole work center. Yeah.
Okay.
I was doing triage that night, and so we have three positions. We have 3 nurses, 3 positions. You have a triage nurse, and then we have 2 other nurses that take different rooms. Usually it's 1, 3, and 5, or 2, 4, and trauma 2. And then trauma 1 is one of those rooms where usually we don't have anything in there unless it's bad, and everybody kind of just is in there. So I was doing triage, and I was a charge nurse. It was a regular night. I remember she came in with back pain, and they had put her in. They were going to treat her in triage 1 with some regular medications for back pain. But after the doctor examined her, she was a little concerned, I think, because of her heart rate and some other things. So she wanted to move her into a room and do a more extensive workup, which is what they did. At that point, I don't really know anything because she's taken out, she's not really my patient.
Okay.
So I know that Chris had her. I know that he came to me and said there was some issues because they had ran a pregnancy test on her, and they found out that she was pregnant. And she was adamant. The mother was in the room with her and was adamant in denying to.
Did you see that, or did it was?
No, Chris came to me and told me this was what was going on in the room because we were having an issue.
Okay.
And he was worried about the mother, the dynamics between the mother and the daughter, because the daughter was completely denying she was pregnant, and the mother was relatively upset about that she was pregnant.
Okay.
So
and you're talking about Chris Sanchez.
Chris Sanchez, yeah.
Okay.
And so I told him, well, as long as she behaves, okay, if it's going to make her. And he goes, yeah, she's okay. I think it's going to be fine. So that's the last I heard of it. The next interaction I had was the tech, which was Lori Aragon, come and tell me, HT, you need to go to the bathroom. So I went to the bathroom. There was quite a bit of blood in there. So this was after she came out. She went to the bathroom and was in there for a long time. And Chris was telling me, she won't come out. So I told him, you need to get the key because the bathroom's locked. And so he told her he was going to get the key. And so she came out. But there was some blood in there. So I went to Dr. Vakas and told her, I was worried that she did something to herself physically in the bathroom the way she reacted being pregnant and the things that I was being told.
How much blood was in the bathroom?
It was smeared around, so it's hard to tell exactly how much. But it was enough to cause me to have concern.
Okay.
I really thought she had done something physically to herself when she found out she was pregnant.
Question: when did she find out she was pregnant?
It was pretty early on because we did the urine first off. Any female that comes in with back pain, we do a urine right away because we're worried about a urinary tract infection. And with any female, when we do that, we always do a pregnancy test to make sure we don't give them medications that would contraindicate pregnancy.
Do you know who told her she was pregnant?
I believe Dr. Vasquez did.
Okay.
I believe. I don't know because I wasn't in the room for that because she wasn't. Okay. I wasn't involved with direct care. Okay. But I knew she knew fairly soon because we already were having an issue with the mother being upset about her being pregnant.
Prior to going to the bathroom?
Way prior. Okay. Way prior. Because then they'd started an IV and then they started running blood work on her because once you find out someone's pregnant, then you run another lab test to see how far along they are.
Okay.
So they started an IV and we're giving her some fluids. I guess I don't know exactly what they were doing. I wasn't involved with that kind of care. But I told Dr. Vasquez she definitely needs a vaginal exam. I'm concerned that she did something to herself. That was my concern. And they took her right into the room. And then I told Lori, call housekeeping. They got to come clean this up. Which time she called Leela, who was on call for housekeeping. Then I was just sitting there, and then the next thing Lori comes and goes, HT, oh my God, you better come to the bathroom. I go in the bathroom, and she goes, something's in the trash can. I'm like, I looked in there. There's a clean liner. I'm like, what are you talking about? She goes, pick it up. I picked it. I could feel the weight. I knew then we had a serious problem. I just grabbed the trash can and went right across the hall into trauma 2. The liner was pulled out, but there was another trash bag in there in the bottom, but it was all it was rolled up. So I had to tear it apart. And then, of course, I saw the baby in there. So I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever. I immediately came out of there after I did that, went into the room where she was performing the vaginal exam, and I immediately told her, you have to come out now. And she came out, and we went into trauma 2, and she reassessed the baby. At that time, between me and Chris and her, we determined, there was no reason for us to begin any life saving. The baby was completely gone.
What did the bag look like?
The bag was the original trash bag that was in there. It had trash in it. When I pulled it out, it was spun, where it was tied, and then it was folded underneath the baby in there. So it was like a little capsule the baby was in. So when I had to tear that bag open to see the baby in the bottom. If you would look in the trash, I looked in there. When she told me, she was something. I looked. I said, "What are you talking about?" Because there was a clean liner in the trash bag. So
basically, he was in the bottom, trash on top of him,
and then another clean liner had been put on top. Yeah. So then after that, after we determined we were not going to do any work on the baby, I shut the room down and I said, call the police. And then I didn't let anybody. No one went back in that room. I made sure of that till the police arrived.
And you said, so with the blood in the restroom, you said it was like smeared. Can you describe where all it was smeared at?
On the floor, there was some on the toilet, there was some on the wall.
Do you remember which wall?
There's the one wall that's by the toilet, that's closest to it, where there's a side rail. There was some blood there. There was quite a bit of smearing on the toilet itself. And then on the floor, it was just, smeared around.
Okay. What do you think that is from?
I thought she did something to herself physically.
Okay.
Because she found the interaction between her mother and her daughter was weird.
And so, but just to make sure, mother is patient's mother,
yeah,
and then daughter is patient.
Yeah. So the daughter is the patient and the mother. The interaction between them after she found out she was pregnant, the way the daughter was reacting she was adamantly denying she was even pregnant. She was denying that she had sex.
And you heard her say that?
Yes, she was denying that openly. So
what did Mom say when she said that?
Well, Mom was upset, and the mom was saying, "I can't believe you. You can talk to me. You're supposed to talk to me about this stuff before you were having sex." All those kind of things. She was saying stuff like that, which is pretty common. I mean, this isn't an uncommon thing. I see young girls having sex and,
Right.
and they come in and they're pregnant, and then the mother is with them and find out, and it's upsetting to them.
Right.
You know what I mean? So it wasn't uncommon that that happens.
Finding out your daughter's pregnant is not uncommon. Not the other incident. Not the.
No. I've never seen anything like that.
Okay, just want to make sure. Like,
No.
So just
No, I've seen lots of young girls come in and find out they're pregnant, and then of course they deny it. It's not uncommon that they deny that. No, mom, I haven't even been having sex. You know what I mean? That's a lot of them's initial reaction,
Right.
because you know they feel like they're going to be in trouble. I guess I don't know what they're feeling, but that's not an uncommon reaction that I see with young girls and their mothers, particularly with their mothers in there or father, that they'll deny that they've had sex. That's pretty common.
all right. And so you said it was Lori that called you. You went in, and the liner was still on.
Yeah, there's a clean liner on the top. That's why I was like, "What are you talking about?" And then she said, "Pick it up." And when I picked it up, it was heavy. I was like, "Holy shit!" You know what I mean? I knew right away. I knew. Then I just went straight to trauma 2 with the whole trash can. I just went across the hall and got broke the baby out.
So after you, Doc, and Chris, decided there was no resuscitation, what did y'all do after that? What did you do after that?
I made everybody leave the room, and I told Lori, call the police.
But then after that, what? Anything else?
No, I didn't do anything until the police arrived, and they came and asked me what was going on, and I took them into the room and told them this is what happened, this is what we found, and I haven't talked to them yet.
Okay.
I haven't said anything to them
So
until
between
the officer arrived.
So from the time of declining resuscitation to officer involvement, you didn't have contact with patient or mother?
No.
Okay, just want to make sure.
No, I didn't go in the room till after the policeman showed up, and then I went in there to talk to the patient,
Okay.
and asked her why was the baby in the trash can.
And what did she say?
She said that it just came out of her, and she didn't know what to do. That's what she told me.
And did she say it was breathing, not breathing?
She didn't say anything
She
like
didn't say
that.
anything.
No.
She just said it came out. She didn't know what to do.
Right.
Okay. And at that point, did mom say anything?
Mom went kind of a little bit irate, like, "Oh my God, how could you, But I think the mother was in the assumption that it was a miscarriage. And I told her, "Ma'am, that is not the case. This is a full-term baby that was placed in the trash can." And then and that's when I told the mom, "Ma'am, if you can't control yourself, I'm going to have to ask you to leave the room." Because she's 19, she's an adult.
Right. And what did she calm down?
No, she actually left. She went outside.
And outside to like the waiting room?
To the waiting room, yeah.
Okay.
And then she came back in.
Once she calmed down.
Yeah, and then when she came back in, and then once I talked to the police officer and stuff, some of the family had started showing up. And she went back out there, and at that point, I told them, because the officers asked me to not let anybody in certain rooms, and so I told everybody, and I even went out there and addressed the family. I said, "I'm sorry, the police are here now. This is kind of an investigation thing. We need to find out what happened, and no one will be allowed back into the working area anymore."
Right.
And so I kept them in the waiting room after
Did
that.
they have any comments?
Not one.
Really?
I was really surprised. Not one person asked me about the baby, if it was alive, if it was dead, if it was a boy, if it was a girl. No one asked me anything. Not even, she didn't
Not
even
even the
ask.
patient?
No, she didn't ask. The only thing she started doing was crying and started talking about she didn't know what to do. Not one. I've never seen I've delivered multiple babies and I've seen multiple miscarriages, and I've never seen a reaction like that. And I don't even know what to say about that. I've never seen anything like it.
How would you describe the reaction?
I think there was no emotion except for herself, and she really wasn't even crying tears. She was just, and the only thing she was upset about was that I think she was going to be in trouble with her mother. That was her only concern, in my opinion. There was no concern for the baby. No one asked me any questions about the baby. Not even the family members, when I went out there and talked to them, did they say, normally people, I would think, would say, was it a boy, a girl? No one asked me one question about the baby at all. Not one.
The whole time.
The whole time. No one asked me anything about the baby's condition, if it was a boy or a girl, anything. Nothing.
Okay. Did you have any interaction with her when she got? I know she was flown to Roswell. Did you have any interaction with her then?
Because when we looked at the baby, the umbilical cord was still completely attached. So then I had concerns about her health. When the baby comes out like that, we worry about the placenta being still attached, which causes the mother to bleed. Mm-hmm. So at that point, our concern was about her.
Right.
And getting her somewhere. Probably, I envisioned that she probably was going to have what we call a D&C to get the rest of the placenta out of her to make sure she'd be okay. So I was in there explaining to her, this is what's going to happen. We're going to have to fly you to Loveless, for you can see an obstetrician to take care of this stuff. So I explained what we were going to be doing with her at that point. But it was just basically, my job telling her, this is what I need to do to make sure you're safe, and you are okay with that.
There's no more conversation about the baby, or
I didn't have any conversations with her about the baby at that point. Okay. No. My only conversations with her were about what I needed to do to ensure her health.
And at that point, Mom still hadn't asked about the baby?
No, Mom was already out in the waiting room at that point. Okay. We didn't let her back in. But no, she didn't. Okay. Now, I know that I had because I had called the house supervisor to come down because this is a big deal. And I know that she kind of intervened on some things in the room. I don't know exactly what they talked about. Right. But I know that Marina was visibly upset about the conversation she had with her.
Yeah, we talked to her yesterday.
Right. So I don't know what their conversation was. I know that Marina was quite upset about the conversation they had. That's all I can say. As you could tell, right. I could tell Marina was upset. Right. As most everybody, which was after that point, my job was I had to get back. We still had patients coming in. I had ambulances coming in. I had 2 ambulances show up. I had more patients coming on the floor. I was down 3 beds because I had them coordinated off. So at that time, my attention turned to I have to get everybody functioning. Right. Which not only did I have to do that with the nurses to get them back, I had to pull the doctor aside and get her focused because she was visibly upset. Right. So that was my mind frame at that time was I have to get these people back. We got to, we have sick people still. Can't do anything else. I mean, it sounds cold, but that was my mindset is we had sick people and we had ambulances coming in and I have to get these people back online. We have to get back to work. We have to function. All right.
Yeah, the ER still has to function.
I have to roll.
Okay.
Is there anything we haven't asked you think we should know?
I'm just going to tell you this. I've never, ever seen a reaction like that girl. I don't even know what to say about it. There was zero emotion. I don't even know what to say. I've never seen anything like it. I've seen women that are only married, or not married, but pregnant for 6 weeks and they lose that baby and they're a mess. You know what I mean? That girl went into that bathroom, made no sounds at all, and the baby came out of her. And I don't even know how she functioned that way. To do what she did and with no emotion. I've never seen anything like it.
And it was a pretty good sized baby. Pretty good size.
It looked term to me.
Yeah, me too.
I mean, it was term. I can't tell you that was, but the only thing that upsets me the most is I understand she was scared, and I think her mother had a big dynamic on her, and I understand that. I mean, I think her mother was probably pretty controlling. I don't know that. I'm just speculation. But she gave me no chance to save that baby. I had no chance. And that's not what I do. My job is to save lives. And I had no chance on that baby. She gave me no chance. And we are a facility that you can drop the baby off, no questions asked. I don't even. You can just leave the baby and go. I don't care. As long as you bring the baby to a safe. We are one of those type of hospitals, so it's hard to fathom what was going on in her mind. I don't know. I've never seen anything like that, and I pray to God I never see it again. I mean, it was like I don't even like TV shit. You know what I mean?
Right.
Shit, I don't even know what to say, man.
Yeah.
It was crazy.
All right. We appreciate what you do.
Oh,
I know we've dealt with, we've done a lot of things together. I appreciate what you do.
It's my job.
Every day.
I appreciate
But it's not just a job. It's a calling, and we can tell that you take it to heart. And,
well,
and I truly, as a father, I truly appreciate what you do.
Well, it is very upsetting what transpired.
Yeah.
And it's, like I said, it's harder to choke down when you don't even have a shot.
Right.
She didn't even get a shot at that kid.
Right.
So it's hard. Yeah.
Well, I know you've been doing it a while, so if you need to talk to somebody, don't hold it in.
Well,
Get to talking to somebody.
It's just one of those things you got to put in a case and put it away.
I know.
Go to work.
I know. I've done it many times.
Wow.
So
So you know what I'm saying.
Well, if you have any questions, let us know. Cynthia has my contact info. If we need to get a hold of you, it's okay. Is it okay to get a hold of you again?
Absolutely, man.
Okay.
Yeah. In my opinion, that kid didn't have a chance. And I don't know what she did or didn't do. Can't say for sure. But I know she gave me no chance.
Right.
And that's all that matters to me. I didn't get a chance.
You get a chance to do your job.
I didn't get a chance to save that kid. And I believe wholeheartedly in my every fiber of being I'd have saved that kid. Or we would have got that, he'd had a shot. We'd have got him out of here alive. I don't know, but you know what I mean? I like I said, I don't know. I didn't inspect the child that closely once we looked him over, and there was no signs of life, and he was gray, and there was absolutely no heartbeat. There was nothing, to present life. But I always feel like I always have a shot.
Right.
With whatever comes through my door.
This is the one you didn't have that option.
I didn't have an opportunity. I've delivered. A month or so prior to that, we had a lady come in that was breech. The kid was hanging out or blue. And that kid is alive today and well.
That's good.
So, I really feel like we didn't get a shot.
Okay.
All right, well, try not to hold it in too long, all right?
And it is what it is, man.
Well, you're in that line of work, it just keeps piling.
Well, that's how it goes.
Yeah. All right, well, appreciate it.
No problem.
Hopefully you don't keep you too long from work.
I'm finna go start right now.
Hi, Mel, can you see us?
Yes, can you see me? I'm sorry, I just had to pick up my kids.
Oh,
No, you're fine.
you're fine. I'm Detective Minter. This is Detective Gonzalez.
Hey guys.
Very, very nice to meet you.
Likewise.
So, go ahead.
Give me 1 sec. I need to give my daughter a direction here.
Okay.
On top of the refrigerator. Have Axel get it down. Sorry about that.
No, that's okay.
That's where the snacks are.
Oh, okay. Go ahead and state your name and what you do and where you work.
Heather Marshall Vasquez, MD. I am an emergency physician. My full-time employment job is through Holy Cross Medical Center in Taos, New Mexico, where I'm the medical director. And then I work as an independent contractor for Artesia General Hospital. I work sort of 2 to 4 shifts a month down there.
Oh, okay. Okay.
So for January 27th of this year, you came into contact with Alexee Trevizo. Can you tell us what happened on that day? Just from the beginning of everything that happened.
Yes, she presented, I want to say it was around 11:30 at night. I don't have the chart in front of me, so there's some details I'm going to have to sort of guesstimate from my recollection. Her presenting complaint was for back pain. She was brought in by her mother. We were told that she began having back pain after coming home from cheerleading practice. Sounds like she had gone to bed and then woken her mother up. And so her mother brought her in. And when I initially evaluated her, she really wouldn't sit still. She wouldn't really let me examine her. She had on a very baggy sweatshirt. And, a 19-year-old with back pain, the vast majority of the time, that's not going to be anything serious. But she was just not really acting right. And so I became concerned that there was something else going on, potentially a kidney stone or something like that. I asked the patient and her mother if she could be pregnant. Her mother said, no, under no circumstances. I've been buying pads for her every month. And so I ordered our normal evaluation, which would be some basic labs, including a pregnancy test, as well as a CAT scan of the abdomen and pelvis to make sure she didn't have a kidney stone or something like that. The pregnancy test came back positive an hour late, maybe 45 minutes later. I can't tell you exactly how much time had elapsed when I became aware that her test was positive. So at that point, we sent it for a blood confirmatory test, which is what we call a quantitative HCG, which tells us it gives us a number instead of just a positive or negative for pregnancy test. It gives us a number, and the reason why that number was really significant was because one of the concerns that you would always have in a young woman who is having back or abdominal pain could be a tubal pregnancy, and so oftentimes we need to correlate the level, the pregnancy hormone level, to determine if it's likely that there could be a tubal pregnancy. There's no obstetrics or gynecology at RTG General, and so it would require transferring her. I also verified at that time that we didn't really have the right kind. The ER has an ultrasound machine, but it didn't have the right probe on there. It had what we call the vascular probe, not the endovaginal or the abdominal one, which would be the ways we would look to see if there was a tubal pregnancy or a viable pregnancy. So I was going to have to call the ultrasound tech in. And so it was taking the lab a little bit longer than I would have thought to give us the actual quantitative HCG level. And so at that point, I started getting very nervous because I figured, well, maybe it's a really high number, maybe they had to dilute it down. And I wanted to check on the patient, and I asked the nurse where the patient was, and he said, well, she's in the bathroom. And I said, oh my goodness, how long has she been in there? And she'd been in there for like 20 minutes. And so at that point, I became very concerned. And I said, you need to get her out of there right now. So it took a while for them to find a key. The nurse was knocking on the door, and we heard the toilet flush several times. And so at that point, finally, the door opened, and there was just blood everywhere. And so even though we didn't have the right probe for the ultrasound machine, I felt like I'm just going to look, because I had already called the tech in, but the tech wasn't there yet. So I took her directly to the room and did a ultrasound. I couldn't see anything. Again, it was the wrong probe. It's not the right probe to even, I don't even know if you could see any, it's the kind of probe that we use to put special IVs in the neck. Mm. So it wasn't the right kind of probe. But she was bleeding a lot, and so we went directly from doing the ultrasound, and again, I was waiting for the tech to come in, to doing a pelvic exam, and it probably took me 10 or 15 minutes to, when I did the pelvic exam, her cervix, the opening to the uterus was just wide open, and there was just blood pouring out, and I was really mystified as to what could be happening, because I thought, well, maybe she's having a miscarriage. It probably took me 10 or 15 minutes to evacuate all the blood, and just as I was finishing with that exam, the charge nurse came into the ER and said, I need you out here right now. And I walked out into the main department. The nurse was still a different nurse was still in the room with the patient, trying to get her, clean her up after the exam. And the charge nurse said, the housekeeper and the secretary found a dead baby in the trash can. And so I said, well, where? Because now I needed to verify if the child was alive. So they brought me the trash can. I ran into the trauma 2 room, the resuscitation room, and dumped it out. And it did not take me very long to determine that the child was dead. And I mean, the decision to not attempt resuscitation, really, the temperature was cool, and I also did not want to contaminate if it was a crime scene. So at that point, then my attention shifted to making sure that the mother was stabilized, because I realized she just delivered a baby. I didn't know where the placenta was. She could die from a postpartum hemorrhage. So I contacted the on-call obstetrician at Loveless Regional in Roswell and said, I need to transfer this patient to you emergently. They said, yep, just send her up. I think the fire department just took her up right away. But before we transferred her, I talked to my team. I said, look, we're not going to talk to her until we have police present. I want witnesses present for our discussion with her. At that point, several of your officers arrived. They arrived very quickly. And we went in and I said, we found a dead baby in the trash. And she said, well, it came out of me and it wasn't moving, so I just put it in the trash. And the mother started screaming at her, I knew it. This is after they had both sworn up and down that there was no chance she'd be pregnant. And so at that point, once we got her transferred, and I believe that the officers called for, I'm not sure what steps they did, but we made sure we didn't touch the dead baby. We didn't do anything because we did not want to contaminate the crime scene. And then I documented, and that's it.
What was the baby in the trash can?
I did not find it. It was my secretary, who you should speak to. She told me a few weeks later that she was the one. But I was told it was in a plastic bag that was tied off and then stuck into a plastic bag, and then she put trash on the top to try to hide it.
Okay. So he was
and
out.
I didn't see it, but that was what was told to me.
But he was outside the bag when you saw him.
Yes, they had opened the bag up, and I took the trash can, I just turned it upside down and dumped everything on the bed.
Okay. And you didn't see any trauma or anything to the baby, or? I don't have a very good recollection of that. My brain was 100% focused on, is this a patient I should try to resuscitate? And once I made the determination not to resuscitate, all of my attention turned to making sure that the mother didn't die. Okay.
So did any of the nursing staff find the placenta at the emergency room?
No.
No? Okay.
I have no idea what happened with the placenta.
She didn't deliver it at Loveless either.
She probably put it in the toilet, would be my guess.
And would that have been something that was able to be flushed?
It depends on how broken up it was. I mean, if it's torn, it potentially could have been flushable. Or it's possible the housekeeper could have thrown it away without thinking it was just bloody, because there was blood everywhere in the bathroom.
Really? And did she say anything other than after you told her that you found a deceased baby? Did she say anything?
Just that it wasn't moving, so she put it in the trash.
Okay. And mom screaming, I knew it. Okay.
It was a really unpleasant experience.
I'm sorry for that. I really am.
Is there anything you think we should know that we haven't asked?
No, I mean, you have autopsy results and you can, obviously make your decisions based on that. She was extremely duplicitous. She lied to us the entire time. It was it was an extraordinarily difficult case. The nursing staff were distraught. The housekeeper was distraught. I don't even know what to say. I mean, it's been a terrible case.
Yes, ma'am. One of the worst I've seen in my career.
I've been an emergency doctor for 20 years. I've actually never seen anything like this.
What was the lady's name that found the baby that was when it was tied up in the bag? That was our secretary, Lori, Lori, and I can't remember her last.
Okay.
But
I have her
Dr.
info. We talked to her.
Oh, you already talked to her, okay. Okay. All right. I don't have anything yet.
Yeah, I don't have any other questions.
All right, Doc, I appreciate your time and what you do. And if we have any other questions, would you mind talking to us again?
No, not at all, and of course, I'm prepared to testify if I have to.
Yeah, that's probably going to happen, so. Okay? And
Just the only thing I ask is please help me prepare for it if I have to do that.
yes, ma'am. Yes, of course. With cases like this, they're called pre-trial interviews.
Okay.
So you'll be prepped. Everybody in this case will be prepped prior to trial.
Okay. Well,
Okay.
officers, I don't envy what you're having to do, and I know it must have been a difficult decision, but I think your courage is thank you for doing what's right. Neither the mother of the patient nor the patient even asked what the gender of the baby was. I don't even know what to say.
Nor do I, ma'am. Nor do I. Okay.
Well, just know my prayers are with you guys as you sort of sort through this. So.
You as well, ma'am, and have a good rest of your weekend, okay?
Okay, we'll do. Thank
All
you,
right.
sir.
Bye now.
Bye.
Lori's here.
Okay.
Hello.
Hi.
Sorry, I was trying to get here safely.
Oh, that's fine. And your name is?
Lori
Lori.
Aragon, right?
and Aragon. There's two of us. That's why I was using my middle name.
Oh, you're the one I talked to the day of, though, right?
Yes.
Okay. Well, Detective Gonzalez again. This is Corporal Minter. Well, Detective Corporal Minter.
Hi.
So, could you just start from the beginning? And if we have any questions, sorry if I interrupt you. I just have a habit of doing that sometimes.
Okay, what happened that night?
So so January 27th, the incident happened like 3 in the morning from when you first had contact with the patient to when you last had contact with the patient.
I actually had contact was with the baby.
Okay.
She had buzzed to go to the bathroom, so one of the nurses was going in there anyways because she was gonna set up for them to do pap smear and everything. So she was like, I'll go ahead and disconnect her and she'd go to the bathroom. So I was like, all right. So she was in the bathroom, and then Chris, which is one of our other nurses, he was like, because I was like, dang, she's flushing that toilet like an awful lot.
Oh, so you noticed her toilet
Flushing, yes. And then he was like, well, damn. So I went and I knocked on the door, and I said, are you okay? And she said, yes, I'm fine. I'm just having a hard time going to the bathroom, is what she replied. So I was like, okay. And then I was like, well, push the call light if you need anything.
So you told her to push the call light? If
Yeah, if she
Okay.
needed anything. And then, like a few more flushes had gone by, and then that's when Chris was like, I don't know, because I told him, what if she's having a miscarriage in there and, flushing stuff down the toilet? So he knocked on the door, and he's like, you gotta unlock this door. And then she wouldn't reply, and he's like, if you don't reply, he goes, and then that's when she heard him call for me. And he was like, Laura, you got the spare key to this bathroom? And I was like, yeah. Because we keep like a ring of keys by the desk where I sit. So I went and I got the key, and just as we were getting ready to open the door, she opened it, and all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
And you say where it is also on the floor too?
Yes.
Okay.
And then,
Now, was it covering the floor, or was it like
You could-
splotches?
you could tell she was wiping it up with paper towels because it was like smeared.
Okay.
Yeah. And then, the one that does have the footage of that, she's on vacation right now, is Erica, and she works in lab.
She took photos of it?
Because because she was like, whoa, this is like,
I didn't know that.
yes. And I didn't know that either till just recently.
And
So,
who is that? Erica?
Erica.
Compost or
No, let me give you her last name just a minute. I'm terrible with last names.
Oh, you're good.
But she does have the
Erica
video.
Salas.
Yes. She has the pictures.
Is she a lab tech?
Yes. And
Okay.
she's on vacation right now.
She's the one that's going to come next week.
On the 27th?
Yeah, or yeah, in 2 days.
Okay.
Sorry.
So she, and I did tell her not to erase that.
Good.
I said, do not erase that because that's evidence.
When did she find them? Or when did she tell you about them?
Like, I think it was like 2 weeks afterwards.
Oh, okay.
She had showed me the pictures, and then that's when I told her, do not, because I was like, dude, can you believe that? Like, because we had a patient that was pregnant at the time, just like after that, and I was like, on top of it. Just didn't want another recurrence.
Gotcha.
But yeah, so anyways, the floor was just smeared with blood, blood on the wall, like on the toilet and stuff, and
Do you remember which wall?
it was like the back wall between the toilet and the sink.
So, like, where like, if you're looking at the toilet, like,
Yeah, like say the toilet's right here where you're at, and then the sink's right here. It was like up this way, blood splatter.
what if,
Like,
In your line of work, what would cause that kind of splatter?
I think something that got pulled out or ripped. Like if you rip something and blood just went, it was like once you see the photo, you'll see what I'm talking about. It's just,
so like you say, like, rip, like something went like that?
yeah, like when you rip something, or if you cut something and you go, like you swing your hand and blood just splatters.
Okay, so
That's how it looked.
Oh, okay.
Yeah.
And that'd be on, so this is north, that's east, it'd be on the west wall?
The back wall, yeah.
So, because, like, the call button's on the south wall. So it'd be on the west wall?
Yeah,
Yeah, because the bathroom is like this.
yes.
Here's the door.
Yes, and then there was
There's the toilet, and then the sink,
yeah, and it was up on this wall, the
and then
blood.
the call button.
Yeah, there was like in between here was the blood splatter, and then there was trickles of blood on the wastebasket that was right here in this area, and then there was like smeared blood all over the floor.
Oh.
Yeah, we just kept hearing the paper towel dispenser going and the toilet flushing. So yeah, when we opened up the door, like, we saw that, and then I noticed she had bloody footprints that she was leaving, going back to the room that we had put her in. So I had called housekeeping, which was Leela, and I was like, hey Leela, I'm sorry to bother you. I said, but I think this patient just had a miscarriage in our bathroom and she left like a mess. If you could come and clean it. And she said, okay. So she came down and she started cleaning it, and then she went to pick up the wastebasket, and then she put the basket down and she yelled for me, and she was like, Lori, come here, the wastebasket's heavy. And I was like, what do you mean the wastebasket's heavy? So when I picked it up and I moved it towards the door, I was like, shit, it is heavy. So I pulled it out because it had like a fresh liner inside, so we didn't think nothing of it because we looked. So when I pulled the liner out, there was like paper towels, and we had rolled trash bags already in there, but she had grabbed a few and like balled them up and put them on top of him. So when I removed them, that's when I noticed the baby on the bottom of the trash can just wrapped in the bag. Like she had it tight, like because it was the top was twisted and then like tucked under, like so it wouldn't open up.
So basically, if you like
When you grab trash and you like swing it.
and then you fold it over to like put it down or whatever,
Yeah, that's how it went.
and it was clear.
It was a clear bag.
so-
Yeah, it's one of those clear bags.
So you
So it was a
saw,
hospital liner?
so you saw the baby inside the bag.
Yeah, and then when I picked it up, that's when I noticed it even more because all I saw was black and purple. But once we picked it up, like the bag suctioned to his face, and that's when I yelled for my charge nurse, which was HT, and I told him, "Hey, she put her baby in the trash can." So I handed the baby to him, and he took off to the trauma room and opened up the bag, and then that's when we went and got Dr. Vasquez
Now you say that the bag was suctioned to his face. So was that from?
I think when I lifted it up, it kind of loosened, and so it just where he was still moist, it just suctioned to him.
Okay. All right.
Question for you. When was the last time y'all were in the restroom before her?
We had another patient that was in there, let's say like around midnight maybe?
Who do you remember who it was? Or what they're in for?
They were there too. They left us a specimen on the table there in the bathroom, and I went in to pick it up.
You did it at midnight?
Yeah.
Was it clean?
Yeah.
Okay.
There was no blood or nothing.
So this was fresh to you.
Yes, this blood was fresh. You
And-
could even smell it.
Did the patient at midnight, were they by chance pregnant at all?
Honestly, she to me did not look pregnant, but then she had on a hoodie.
No, the patient that gave the
Oh,
sample at midnight.
No, she was a young girl. She was like maybe 11. So no,
Okay. And there's no blood at all?
No.
She would have noticed, you would have noticed?
we would have noticed.
Okay.
Yeah.
And is the amount of blood consistent with giving birth or a miscarriage or some sort of traumatic event?
I'm sorry. You repeat that?
Okay, the amount of blood in the bathroom, on the floor, on the walls, and is that consistent with the amount of blood that is lost when you give birth or have a miscarriage or?
To me, I mean, it looked like she had given birth in there and was trying to clean it up. Like, it wasn't that much blood on the floor, but you could tell she was cleaning it up because it was, like, smeared and somewhat cleaned up a little bit.
Okay.
Once you see that photo that Erica has, you'll see how we're trying to explain it.
Right.
It's just hard.
Okay.
Yeah, it's just hard for us because Leela had cleaned, because when I talked to her that night, she said she cleaned the blood first, then went to...
Yeah, and I usually, when there's like one or two things in the wastebasket, I usually pick it up and take it out, but I didn't that night. And then, like, I've been kicking myself on this because I feel like, you know, if I would have just taken it out, I would have seen it.
Well, no one prepares for that type of thing. You know what I mean? Most people don't act like that. So don't blame yourself for it.
Yeah.
Because it's not a natural thing to do.
I mean, it's just hard because I'm a mother, I'm a grandmother, and I've dealt with death before, but never like this.
Right.
You know, like, it was horrible.
Don't beat yourself up about it, though, because it's something most people don't plan, or most people can't think of it. To them, it's, like, unfathomable. So don't beat yourself up about it, because it's something you couldn't have prepared for.
Yeah.
Because, like you said before, you're expecting a miscarriage.
Yeah, I was just expecting her to have a miscarriage and call it a day. I mean, we've dealt with patients before that have had miscarriages.
Yeah.
So once the baby was taken into the trauma room trauma room,
Yeah, he went into trauma too.
okay, did you have any? What happened? What did you do at that point?
I just remember I stayed in there because she went to go get Dr. Vasquez, and then I noticed that the umbilical cord looked like an animal had tore it apart. Like, you know, have you ever eaten string cheese? And, you know, when you twist it, that's how the bottom of the umbilical cord looked. And I just remember it caught my eye, and I was like, God. I was like, this chick really ripped this thing apart. Because those things are hard to cut.
Right.
Did you find the other part of the umbilical cord?
No, we're thinking, I'm not sure if she had delivered the placenta, because I wasn't in there when they did the final examination. But either she delivered it in Loveless or she flushed it.
You guys didn't find it at all.
We didn't find it at all. I even looked in the little cabinet that we have in our bathroom, because it has like a bottom cabinet. So I opened that up just as, you know, I didn't want no more surprises.
And how big would that be? How big would the placenta be? Do you have any idea?
No, I would say maybe me personally giving birth myself to a full-term baby, it would have to have been about the same size as the baby.
How?
Because I've seen placentas where we've delivered a few times here, full-term babies, and their placentas are pretty good size or like that. Like, they fit inside of one of our basins.
Right. And is it thick?
It's like a,
Or is it like
it's kind of thinnish.
kind of like a sirloin steak?
Yeah.
Thin?
Like a-
you know,
Looks like roast beef to me.
okay.
Oh, that's not a good picture in my head.
I'm just trying to describe
So-
it. But we didn't see it.
Okay.
And that, honestly, I thought that's what was in the wastebasket, was her placenta.
Mm-hmm.
I did not expect to see this full-term baby. wrapped up in a trash bag.
So, after, like with HT and the doc at the room, did you do anything else with the baby or the patient after that?
After that, I was told to get a hold of the on-call OB in Loveless because she needed to speak to her because she had to transfer that patient out because she was bleeding.
Okay. And so you're the one that talked to OB?
I was the one that got a hold of the Loveless hospitalist. I believe her name was Stephanie. And I had set up to where we got this patient transferred to Loveless so that way they can go in and clean her out and stuff to make sure she wasn't hemorrhaging or anything like that.
Okay. After that, any other involvement?
The only time I saw the patient was when I went in to have her sign her paperwork, the teleforms that she has to sign, because flight crew was on their way to transport her. That was the only time I had any.
Did she say anything?
She just cried.
She was just crying?
Because there was 2 police officers in the room with her at the time.
Okay. How many times did you hear the toilet flush, do you think?
More than 10 times. Because that's when I was like, dude, something's going on in there.
Okay.
And so that's because over 10 times in a year, like, and how long, what span of time did the toilet flush?
It was like, once it flushed, she waited a few minutes, and then she'd flush it again.
And like, how long do you think that was? Like, if you had to give a guess, how long do you think it was the whole time?
Out of the whole time between the flushes?
No, like all.
From the time she went into the bathroom to the time she came out.
Oh, maybe 15, 20 minutes?
And how long of that was she flushing?
About maybe 10 minutes of her being in there.
It was just constant flushing? So 10 minutes of constant flushing of 15 minutes being in there?
Yeah. Yeah, because when she ran to the bathroom, I did see her pass me. Because I remember I told the girls, because she had her hand on her crotch and one on her butt, and she was running to the bathroom, and I was like, damn, I guess when you gotta go, you gotta go. And, because the lab tech, Erica, was sitting there, and we were talking, and she was like, dang. She was like, really? And that's when we noticed she was in there for quite some time. So I don't know if maybe the baby was already coming out, and she just ran to the bathroom as fast as she could, or what.
So, for any other patient there, do you think anyone else could have delivered that baby?
We would have known.
You would have known? Okay.
Was there any other pregnant people on the
That
ER
night?
that night?
No.
And you said the last patient to visit was a 11-year-old female that gave y'all a sample?
Yeah. And her mom went in there with her.
And you were the last one in the restroom prior to...
That I know of, yeah.
That you know of? Okay. Alright, and you didn't notice anything like that, right? Okay, just gotta make sure.
No, I didn't notice nothing like that in there when we go to get urine from the bathroom. And I mean, patients were in and out of that bathroom, so I'm thinking, like, even the males, if they would have seen something like that, they would have said, hey.
Especially a dude like, hey, what...
This bathroom's disgusting, you know.
Right? Is there anything you think we should know that we haven't asked you?
No.
No? Okay, well...
I gave you guys everything I pretty much know. I mean, that's just something I'm never going to forget.
Right. Well, and I appreciate you telling me about Erica, because we didn't... we took photos after everything was clean. I didn't even know there was photos, so that's news to me.
Yeah, and then I had forgotten your name, and then I was like, and I haven't seen any of the other officers that were there that night, so I was like, oh shit, who the hell do I call? Like, and then I figured, well, they'll get a hold of us.
Yeah.
And then I thought, well, that's why I told Erica, do not erase those.
Right.
That's evidence that they need.
It is.
Yes.
It would be really helpful.
Because once we noticed that, that's when I had housekeeping stop her cleaning. And I go, that's a crime scene.
Well, she was very thorough, because it was very clean whenever we went in there.
She had gotten it, but like the wastebasket and all that, I was like, just leave it, because I remember it still had a little bit of blood on it.
Yeah, it had like a slight smear on it. We took photos of it. So you've been a nurse how long?
I'm a CNA.
Oh, CNA? For how long?
Maybe like 16 years.
Oh, so you've been in the ringer.
Yeah. I've done nursing home. This is actually my first time doing hospital.
Oh, I'm sorry.
Yeah. That's why I said, like, I was used to deaths, but nothing like this.
Well, just reason I'll ask. So you said it was fresh blood, right? Have you dealt with dry blood, like dead blood?
Mm-hmm.
So does this smell fresh to you or dead?
This smelled fresh. Like, I don't know how to explain it. Just,
But just in your experience, it was
yeah,
fresh blood. It hadn't been stagnant for a while?
Mm-mm.
Okay. Just wanted to make sure.
Yeah.
Okay, well, you have our contact information, and I gave the HR, Cindy?
So, yeah.
Cynthia. Sorry, there's a Cindy that works here too.
Yeah.
I gave Cynthia my contact information. If you have any more info, you can let me know, okay?
Okay.
I appreciate you.
Thanks, Lori, for coming in.
Thank you. Yeah.
And thank you for what you do.
Thank you. Yes.
Yeah. Hopefully it gets easier, right?
Yeah. Yeah. Well, I mean, I've dealt with stab wounds, gunshot wounds, but never like this.
Yeah, I understand.
This one was like the most gory thing I've ever had to. It looked like a Stephen King film.
Well, talk to people and keep your hobbies up, okay?
I
That's
will.
all I
Thank
can
you.
All right, thank you.
Thank you, ma'am.
Thank you so much. If you have any questions, you guys have my number, right?
Yes, ma'am. I got it from you the day of.
Yeah.
Yes, ma'am.
So if I don't answer, just shoot me a text. Sometimes I don't. If I don't know the number, I don't answer.
Okay, that's understandable.
Sounds like my mother.
Thank you, ma'am.
Thank you.
Hi. You Chris Sanchez?
Chris Sanchez, yeah.
Nice to meet you. Barnabas Gonzalez.
Jim Minter. Nice to meet you.
Have a seat.
Yeah, have a seat.
I don't know if you've been briefed on anything. You're not in trouble. An incident happened in January on the 27th of this year. Do you remember it at all?
Yeah, I'm assuming the 19-year-old that was pregnant.
Right.
Yeah.
Can you tell us what happened, what you did with it, what from the beginning, from like when you first saw her to when you last?
Sure. So I triaged the patient.
Okay.
Brought her into our triage room, asked her some of the intake questions, and then moved her to a treatment room. I probably started an IV, gave some medications.
Okay. Anything else?
What was her chief complaint?
Chief complaint, if I can remember. I think it was abdominal pain or flank pain, something like one of those two.
Do you remember what treatment room you moved her to?
Possibly two. I think it might have been room two.
Okay.
Yeah.
Anything helps you remember that?
No, just looking at, kind of thinking of the layout of the ER.
Gotcha.
Um,
So you triaged her from, did you bring her in from the waiting room?
Yeah.
Okay, so you brought her in from the waiting room, took her in the treatment room, and then, you triaged her, you just got her chief complaint, did vitals?
Chief complaint, vitals. I believe the doc came in and kind of did a quick assessment in the triage room before we moved her back to a treatment room. Then from there we gave her some pain medication. She started feeling a little better, and then she said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
So what did you do after that? So when she went to do the bowel movement, where were you at?
Initially, I was at the nurse's station, and then at some point I went and kind of checked on her, knocked on the door, seeing if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flushed it, toilet flush?
Yes, after a while I started hearing, so I probably checked on her 2 to 3 times, I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again, did she need anything? Denied anything. And then eventually it got to a point where I said, you need to come out. And I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that
She
point?
didn't say anything. She was just looking kind of straight past me and went back to the room.
Did you look into the restroom?
I did.
Oh,
Yeah,
what did you
so
see?
went into the restroom and I saw a large amount of blood.
Where
And it was on the floor. It appeared to, like, she had tried to wipe it up in places. It was kind of on the back wall behind the commode, the toilet. And so I said, you know, you okay? What happened? And she said, I'm on my period, what she said. And she walked out. And then I went in, because at this point we had already received the positive pregnancy lab test.
When was that?
I couldn't tell you the exact time, but I know prior to that, we got a positive pregnancy test on her.
Okay, prior to the bowel movement, did you tell her that y'all got a positive?
No, the doc hadn't been in there to tell her yet.
Okay, so, okay.
Yeah, so went in there, and I did look into the trash can at that time to see if there had been anything tossed, but the liner was fresh and completely empty. I didn't pick up the can, obviously I would have known, but I just looked in the can and there was nothing in there. It was a fresh liner.
So there's no trash in the
There was
liner?
nothing in there, yeah.
Do you know if they keep fresh liners? Because I know some places they put
Yeah, there's usually
new
like a
liners
roll.
in the bottom of the
Yeah.
trash can, and then they put the liner in and
Exactly.
then take the trash out.
Right, that way when they change it, they can just put a fresh one in. So yeah, there's usually a roll or a bunch of extra liners at the bottom of the trash can.
So you said there was blood on the floor, and it looked like some parts of it looked like it had been.
Right,
wiped
it looked like it had been wiped up.
Well, and you said on the wall. Was there any on the toilet?
I think there might have been some at the bottom of the toilet. I don't remember if there was some like on the actual seat.
Okay.
No,
All right, and then so the doc hadn't told her that she had popped.
not yet.
So like, because speaking with Vasquez, she said that, and don't quote me on this, but like y'all did a urine and then a blood.
But, right, so typically they'll do a urine and that just tells you negative, positive, and then they do the blood. It kind of gives them a range of how far along.
So
how far along she
did
is.
the urine come back after as well, or so did all of it come back
Well,
after she came back?
It probably all came back before.
Okay,
The,
but the doctor would be the one to tell
yeah,
her.
the doctor would be
Okay.
the one to go into the room and tell her. And after she came out of the restroom, that's when she went in to do a vaginal exam. Obviously, we didn't know what this blood was from. We were a little concerned that maybe she had known that we were going to figure it out and that she might have harmed herself or something in the restroom. So the doc wanted to go check her, but obviously that wasn't the case.
And how long have you been working here?
Here, about 5 years.
Okay.
Yeah.
So during your time, if someone were to pull the emergency cord have you been here when somebody pulled that?
Yeah. For
So
the
if
restroom
somebody
specifically.
Right. So if somebody pulled that cord, y'all would have known.
Oh yeah. The restrooms typically at every facility will give a different chime than a room, like a room call bell.
Right.
It's like more of an urgent chime, I guess you would say. Yeah, just so that way everyone knows it's not just your normal.
Right. And to your knowledge, that alarm never went off.
That alarm never went off.
Okay.
Yeah.
So then what occurred?
So after that, her and the patient went back to the room. The physician and a female nurse went in to do the vaginal exam just to make sure everything was good there. I believe, I wasn't in the room, but I believe that's when the doctor said, hey, your test came back positive for pregnancy. She adamantly denied it up to that point, even with me the entire time. She said she was a virgin. She's had her period every month consistently. So the doc was doing that.
Then you said that, and she told you that when you were
She
triaging.
told me that in triage,
Okay,
yeah,
okay.
that she was a virgin and that she had her last pregnancy was just prior on that month and had.
You mean period? Because
Yeah,
you
sorry,
said pregnancy.
I'm
yeah.
sorry, yeah. Her period, she had them consistently every month. So then I started doing my charting, and then we called in the housekeeper to clean the restroom. We call it like a terminal clean, just when it needs to be mopped and everything. And then she felt the weight in the wastebasket, and then that's when we found the baby, and then moved it into the trauma tube. And
Did you find the baby? Did you see the baby?
I saw the baby.
In the trash can or?
In the trash can. HT, he was there. He's another nurse, and Leela, she's the housekeeper. They initially found it, and I went over there and saw what they had.
And what exactly did you see when you looked in the trash can?
I think at that point they had already ripped the bag, but it was just laying, at the base of the trash can under the liner that they had pulled up, and there was like some paper towels in that bag with the baby, and then we moved it over and took it out, put it on the bed, on the stretcher.
So HT and Leela found it. You were. So
Yeah.
what made you go to them? Did they tell you something, or did you just go?
I believe Leela basically called out for HT, I think, and then he went over there, and then I went over there as well.
Okay, you went to go see what happened.
Right, to see
Okay.
what, because typically if someone's calling out in the ER, it's not
Bad.
good. Yeah, it's usually not good. But,
Well, and you said you've been working here 5 years, so
yeah, I've been working here about 5 years.
so you're already prepped for something bad.
Well, not necessarily like this. This is definitely unusual for us, but yeah, for bad stuff. If you hear someone kind of calling out, you always go check to see if they need help, basically.
And could you tell if the baby was alive or
They did
Passed.
not look alive.
It didn't
Yeah,
look
did
alive.
not look alive. It looked. But also, I think the time had passed since she left the bathroom and it being in the bag. It was just
how long do you think that was?
maybe like 10 or 15 minutes. I just have a
Right.
guess. I don't know. I'll have to look at
And after the doctor went in and told her she was pregnant, did you have any other contact with her after that?
with the patient.
Mm-hmm.
I might have went in to have her sign some paperwork, but that was probably
That was it.
we had to transfer her
Okay.
to get OB care and post.
Okay.
Did you have any contact with the baby after that?
All we did, we brought the baby up. We called the doctor, obviously, out of the room from her exam, and we came in, kind of. Doc assessed the baby, and basically determined it was not viable to completely work the baby and all of that. So that was about the extent of it.
Okay. So and then your last contact was doing paperwork to transfer her out?
Yeah.
Okay. Do you know of anybody else that would have had contact with her that we should talk to?
Marina Perez, she was the house supervisor, and that's probably about it.
What does she do?
She came in and I don't exactly remember. She had a form of paperwork that she was helping fill out with.
Oh, so
the
she's
patient.
filling out paperwork.
Yeah, with
Okay.
with the patient.
Did you see anything in the hallway? Any type of blood droplets or blood from the bathroom to the trauma room? Did you see anything?
I believe there was maybe from footprints or something. There might have been blood coming from the restroom to back to her room.
Okay.
All right. Is there anything you think we should know about that we haven't asked?
Not necessarily, not like factual things, just
Yeah,
it
just-
seemed like we were being just deceived from the beginning, but that's just my take on it. It seemed like she was very manipulative with us, and
What did she appear like when she came in?
she
I mean, could you because I know most women you can tell unless they're a large woman.
right.
She's a petite girl. Could you tell that maybe she was pregnant or?
I could not. She was very what would be the word? Not necessarily standoffish, but anytime you asked her to lay down, she would kind of maneuver away from you almost. It seemed like, thinking back, she wouldn't want you to kind of. It was at least what it seemed like to me. She didn't want you to discover, that she was pregnant, and she wore really baggy clothing. And she wouldn't sit still for you. I'm sure she was very uncomfortable too, but yeah, she wouldn't allow you to do it.
All right. Can we get a?
Wait.
No, it's okay.
I'm looking for you guys everywhere.
No big deal.
All right.
All right. Thank you, ma'am.
You're welcome. How you guys doing?
Good. How are you?
Good.
Coming into work?
Yeah.
Okay. And are you Elizabeth Crawford?
Yes.
Detective Gonzalez.
Nice to meet
Jim Minter, nice to meet you.
All right. So
You're not in trouble.
I know.
Okay.
okay.
We just want to start that off with all the interviews.
So If you could you just tell us everything from your contact on January 27th with either the patient or the child, any contact you had from beginning to end?
I didn't have much contact with her until she exited the restroom. I didn't take care of her before that. But
So the
after
patient.
that, I took care of her. Yeah.
Okay, can you tell us what happened?
So she came out of the restroom. There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems, essentially, I'm not sure the exact words, because it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which didn't seem totally abnormal. It seemed awful miscarriages before they were very bloody.
Right.
And so...
Was she bloody?
Mm-hmm.
Like
And then there
her
was-
legs? And
Yeah, she had blood all down her legs, and then there was blood in the bathroom everywhere. So,
Okay, and you saw that?
Mhm.
Okay.
and then got her in the bed, got her in a gown, helped her clean up. Doc came in, we did the pelvic, essentially, and then HT had come in and took the doctor away, and then I helped her get back in the bed, get her comfortable. I went to go get her blankets. And that's where the baby itself was in that room where the blankets are. So then I went back in there and essentially just took care of her tried to as a postpartum patient from then on.
Right.
That's about it. After that, we had ultrasound come in to essentially make sure there's no products of conception left in there. I think they booted the mom somewhat after the pelvic exam was done.
Were you in there when let's go back.
Okay.
You said you saw blood in the bathroom. Where did you see that?
It was just on the floor, with white marks.
Okay.
Essentially, she had tried to wipe it up.
Was it on the toilet? Was it in the where exactly was the blood and how much?
It was a good amount. It was on the floor, essentially.
Okay.
So I don't remember seeing any a lot on the toilet or anything like that.
Okay. So when you came into the room, did she say anything? Did you say anything to her?
Once we all figured out what was going on and I went in there, she essentially was scared. She was worried that she was going to get in trouble. She did have the back and forth with her mother that was just about they had said, the mom was upset because she had had sex and hadn't told her. So they were going back and forth on that, and then she was just denying it, which was a little wasn't really deniable at that point in time.
Right.
So the patient was denying having sex at this point to her mom.
Yeah, she was trying to state that she was still a virgin.
After she came in from the bathroom and all the blood and all that. Okay.
So did the pelvic, and then I think shortly after that the mom was in the waiting room after that. And then she was just worried. She was asking me what was going to happen. I told her obviously I did not know.
Is this when you found out she was worried about getting in trouble? Did she tell you anything
She didn't say anything about what had happened. She was just essentially worried that she was just going to get in trouble.
So that's what I mean. Were those the questions she was asking?
So what's going to happen to me? That kind of thing.
Did she ever ask about the baby?
No.
Not once.
And so her focus was her getting in trouble. And anything other that she talked to you about?
She did at one point in time when the ultrasound tech was in the room with her ask if there was anything. She pretty much said, would there be any bad outcomes if she had stopped taking one medication and stopped taking another? And I said, well, what medications are you talking about? She said, well, what would happen if I stopped taking birth control and started taking weight loss medications? And I was like, I don't know.
It's an odd question.
I thought so.
And how long have you been in RN?
years, almost 2 years,
And you live here in Artesia?
in Carlsbad.
In Carlsbad?
So you got her the blankets.
Mhm.
After that, what did you do? Did you have any more contact with the patient?
Yeah, I just popped in periodically and like checked the amount of bleeding, make sure she wasn't like hemorrhaging or anything.
Okay. And then, so until she left, is that what you did? Did you do anything else other than checking on her, make sure she was okay?
Just that.
Did you participate in the pelvic exam?
Yeah, I was in the room.
Okay. Were you able to see, did it appear that she gave birth based on the pelvic exam in your experience?
Would you be able to tell?
Yeah.
No.
No,
Okay.
You weren't, okay.
So I've never done OB, so
Okay.
what a pelvic exam looks like after birth, I have no idea. I could say that there was a lot of blood, more than normal, like in a normal pelvic exam, obviously.
Right.
Like we tried to get the suction working because there was so much blood, but it wouldn't work, that kind of thing.
Right.
So,
Okay. So, after she left, did you do anything else? Have any other contact?
Mm-mm.
And so that was just your side of it? That's everything you did?
Yeah.
Okay. Is there anything we haven't asked as of yet that you think we should know about?
nothing that I think of.
Okay.
The only thing was just those medications that she was asking about. That was weird.
Just what would happen if you stopped birth control, started weight loss?
Mhm.
And she didn't expand on that? She didn't tell you why she was thinking that?
No, it seemed obvious in my head though. So,
Could you tell me why it seemed obvious?
well, it seemed like she'd been trying to hide this pregnancy from her mother for some time.
Mhm.
So if you know you're pregnant, you're not going to continue taking birth control pills. But if you're trying to hide it, you might start taking weight loss medications. That's just kind of what it seemed like in my head.
Okay. Just want to make sure, because it seems like it to me. Just want to make sure. I'm not thinking.
And was the argument between her and her mom pretty heated?
I would say heated. It was awkward.
Awkward?
Yeah, like they were going back and forth, and her mom was definitely angry.
And patient is 19.
Mhm.
Mom is quite a bit older.
Mhm.
Gotcha.
And they never once asked about the baby? During the entire time you had contact with her once she left the bathroom? Even after they found out that the baby was found and all that? They never asked anything about the baby?
I did go, now that I think about it, I did go check on the mom just to give her an update. And I think she asked about the situation, asked what was going on. But I told her I couldn't tell her anything. So I just went to go tell her that she's being transferred to Roswell.
Right.
And give her an update on her daughter, essentially. And that she asked about what was going on with all of that. She said, what happened in the bathroom? What happened in the bathroom? I said, I can't tell you anything.
Right. But nothing specific saying,
Right. That's
what about the baby?
correct.
Okay, I don't have any.
Got a birthday coming up.
I do.
Happy early birthday.
Thank you.
Hopefully it's better than this. Alright, and you're doing okay, right?
Yeah.
Okay. Alright, well, just
With
make
this, we've asked everybody that we've interviewed that's had something to do with this because it's pretty traumatic.
Yeah.
Most people don't
sure. Deal with
see
this.
that kind of stuff on it. I mean, I know you see death and in your job, but a newborn baby is a little more intense
Yeah.
in my belief. So
Alright, well, try not to keep you from your job.
we
Appreciate you coming in.
Appreciate you what you do. There's my card. You refer to
HR has mine. If you
Okay.
need any contact, let us know.
I will.
Thank you.
Hi, ma'am.
Hi.
Hi, Miss Lewis.
Hi.
How are you doing?
Good.
No, I'm good.
Okay, thank you.
I'm Detective Minter, Jim Minter.
I'm Leah Lewis.
Nice to meet you.
Second off, I met you the night of.
Yes. Let me turn off my phone.
It's okay.
That's fine.
Yeah.
Okay.
So, can you tell me everything that happened on January 27th?
Okay.
Like your involvement from
The time I was called.
to the end.
Okay, I was called and to go clean the patient's bathroom in ER around, maybe 2 o'clock or so, I think it was the time, I'm not too sure. So when I went in there, it was a gory, bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall,
Do you remember which wall?
the one behind the toilet, and then the one on the side right here. You know, there's the one where the toilet sits, back of that,
Yeah.
and then on the side,
Where the call button is?
yeah,
Okay.
and on the floor, everywhere. I mean, it was
Was it like this is the bathroom, here's the toilet and the sink, then here's the door. So was it just like this, or
actually, it was all over the place, all over the floor, because even when I was going into the bathroom, there was blood on the coming out of the bathroom on the floor.
okay,
So it was everywhere.
okay.
So there's blood coming out of the bathroom? Do you
Yeah,
know how far it
footsteps.
went? Okay.
I think they were the person that was in there, her footsteps, as she was coming out. Because I was like, oh my gosh, you know, I mean, it's even out here.
How far out did you have to clean to get it?
From the outside,
Yes.
right by like around the water fountain,
Where's the water fountain at?
right there.
Oh, right next to the restroom?
Yeah.
Okay.
Well, if it's on the left.
Yeah.
Yeah.
So it went out to the water fountain. Did you have to clean like the hall or anything at all?
I mopped up that area right there. Where
Okay.
And was it footprints?
Yeah, I was.
Was it footprints in the hall?
Yeah, when, you know, I guess she stepped on it, you know, and then walked out with it, and then their socks were wet.
Okay.
But it wasn't all the way to her room or nothing like that. It was just right by the water fountain.
So just footprints in the hall to water fountain?
Yeah.
Okay. And what else happened?
Okay, then I went in there, and then I started cleaning. I started. First thing I did was I started mopping, because we can't be walking around on that blood.
Okay.
So I started mopping, and then I started. After that, I started wiping everything down. Then I went to the toilet, you know, and I cleaned the toilet, and then I got everything. I had to do everything like twice because it was, you know, bad. I wiped down the walls and everything. And after I did all that, I usually throw my trash first, but for some reason that night I had to clean the floor up and everything else. And when I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was trash in it, but I knew that it didn't feel like when I picked it up it was some weight, so I thought it was the trash bags, because we put the trash bags on the bottom.
Mm-hmm.
And so I started getting the trash out, and then when I did that, I seen that there was a baby in there, and that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash, and the baby, when I looked at it, the baby was wrapped up like in a, you know, like at the bottom of the trash can, and with trash on top of it, in a trash bag.
And so how did you see it, like as soon as you picked it up?
No, after I picked up the trash bag that was on top, you know,
Okay,
where
so
they were throwing the trash at, when I picked that up to change it, that's when I noticed that there was, when I seen the baby.
Okay, so you lifted the liner and then saw
Yeah.
the baby, okay. And I know this bugs you, but can you like describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. You know, I don't know how to describe it. You know, he wasn't bruised or nothing like that, and he was like purple, pink skin type color.
Okay.
How was the bag? How was the bag placed, or what?
It looks like she wrapped it around like that, and then wrapped it like under him, and then put him on the bottom of it.
Okay. And was the baby moving at all?
No,
Okay. Did you touch him at all?
no.
Okay. And so you said you called HT and Lori?
Yes.
Okay, what happened? What did you see after that? What did you do?
Okay. When all that happened, I moved the trash can. I told them that there was a baby in the trash. I could barely talk at that moment, and so then they took over, and I left. I mean, I went up to the nurse's station, and then they called the doctor and everything and all that stuff.
After that, did you have any contact with the baby?
No.
Okay. And then, what happened after that? After you went to the nurse's station?
Oh, they all went over there with the baby.
What did you do?
I just stood there and I was freaking out, and everybody was, asking me what's going on and whatever, and I stood. I didn't go back over there where they were at.
Okay. And then, was that whenever I showed up, or?
Yeah, that was about the time you showed up.
So you were just at the nurse station until I showed up and talked to you?
Yeah, well, after that, I went back to EVS, to the department I work at.
Okay.
I went over there and trying to get away from that for a moment. And I went there for a little while, and then they called me and told me that you were coming in for me to go wait in the ER.
Okay.
And that's what I did.
Okay. And other than this, is there anything that I asked you that I haven't asked you that you think I should know?
No, I think that's all.
Think that's it? Okay.
Yeah, if I can remember of something, I'll write it down. That way I won't forget.
All right, and Grave Trader, Cynthia has my contact information, so if you need to call me, and there's his card as well, you can let us know, okay?
Okay.
Are you doing anything to make sure you're okay?
No, I'm not doing anything right now. I thought maybe I could do it on my own, but there's some days that are harder than others. So when I feel that way, I feel, see, I just went through a trauma in 2018. My boyfriend in Carlsbad blew his brains out in front of me. So he committed suicide.
Oh.
So I was traumatized over that for a long time. And then now this, so it's kind of, sometimes I have a problem with it.
Nothing wrong with asking for help, okay?
And I don't know if you're a churchgoer or, I don't know what faith you are, but sometimes that helps as well.
Yeah, in fact, that's what helped me with my boyfriend, the churches.
Right.
That's what I turned to.
So you might.
Because I was looking for answers, and there's no way I could ever find out why he did it, because he's not here to tell me.
Right. Well, I'm sorry for that. I'm sorry for your loss.
Thank you.
I really am.
So,
but please try to get somebody to talk to, because it'll eat away at you. I promise you, and just get some sort of closure for it.
okay.
Okay.
Yes.
Yeah, like talking to friends, family,
Mm-hmm.
like going to the church and just talk to them. Don't even talk to them about what happened. Just say like, hey, I have some stuff. Can I just talk to you about anything?
Right.
If
Okay.
you're Catholic, just go to the priest and say, I need to talk. I don't need you to help me. I just need you to listen and let me get it off my chest about what trauma I went through.
Okay.
Because, just getting it out in the open, because
Right.
I know you're mad. You're mad that your boyfriend did what he did. You're mad that he's gone. He's mad. You're mad.
Mm-hmm.
So getting that out, saying I'm mad, and talking to a priest or a pastor or whoever
Right.
will help you. Trust me, because I've been through that. I lost my son in 20, and I've done lots of that.
Right. And and I was, because I didn't know why he did it. He didn't ever show any signs or anything like that. So I'll try to look for answers, and I'm never going to find them because he's not here to tell me. So that's what my main problem was. I needed to know, and that was making me go crazy.
Well, there are like survivor groups here in town and just around that you can talk to.
Yeah.
People like in your shoes that somebody's left them behind that they don't know.
Right.
But it's good to have people that you can relate to and talk to that won't judge you.
Yeah, for sure.
So I would like try and find them that you work at the hospital. Maybe they have stuff that they can help you with.
Yeah, they have behavioral health here.
Right.
Mm-hmm.
And when all that happened, I had to see a psychiatrist and a therapy, and the therapist put me on all kinds of medication. I was like a walking zombie, you know, and I didn't want to feel that way anymore.
Mm-hmm.
And I needed to come out and do something for myself because he was the main provider. I had to come out and work because, how was I going to survive?
Right.
So that's when I came here and I applied, and they gave me this job that I have now. If it wasn't for them, I don't know what I would be now. The hospital has really helped me out.
Good.
And so they offered me. When I applied, I told them my situation. I'm like, my therapist didn't think it was a very good idea for me to work here, but I'm going to give it a chance because she said that I could probably have a relapse if I were to see like a lot of blood and a lot of, that I said, let me give me that chance and see if I can. So I've been here 4 years now.
Good.
So it helped me out a lot, but yeah, they have a lot of help here, like with behavioral health and everything. But I just wanted to get off of that medication, and I did it myself because I didn't want to feel that way no more.
Right.
But I had to face reality.
Nothing wrong with that.
So have we asked you, have we had not asked you anything that we should ask you, or do you have anything that?
No, I think y'all have asked me
Okay.
everything. And like I said, if I remember something, I'll write it down
Yeah, just let us know.
and let you know and call you and tell you about it.
Yeah, nothing wrong with
Okay.
that. And just like I said, talk to people, talk to friends, talk to family. If you go to church, talk to your priest.
Okay. Yeah.
All right, it'll help.
Okay. Yeah, and then with this, I just talk things off for me. So.
Right.
Yeah, just shake it off, take a deep breath.
Okay.
One day at a time, okay?
Okay. Well, thank you guys. I
Yes,
appreciate it.
Thanks for coming in. I
Okay.
appreciate you coming in.
Thank
You're
you, ma'am.
welcome.
Thank you, ma'am.
Okay, you're welcome.
Prayers will be with you. Okay, here's your phone.
Oh, okay. Thank you.
Uh-huh.
Hi. You Chris Sanchez?
Chris Sanchez, yeah.
Nice to meet you. Barnabas Gonzalez.
Jim Minter. Nice to meet you.
Have a seat.
I don't know if you've been briefed on anything. You're not in trouble. An incident happened in January on the 27th of this year. Do you remember it at all?
Yeah, I'm assuming the 19-year-old that was pregnant.
Right.
Yeah.
Can you tell us what happened, what you did with it, what from the beginning, from like when you first saw her to when you last?
Sure. So I triaged the patient.
Okay.
Brought her into our triage room, asked her some of the intake questions, and then moved her to a treatment room. I probably started an IV, gave some medications.
Okay. Anything else?
What was her chief complaint?
Chief complaint, I do remember. I think it was abdominal pain or flank pain, something like one of those two.
Do you remember what treatment room you moved her to?
Possibly two. I think it might have been room 2.
Okay.
Yeah.
Anything helps you remember that?
No, just looking at, kind of thinking of the layout of the ER.
Gotcha. So you triaged her from, did you bring her in from the waiting room?
Yeah.
Okay, so you brought her in from the waiting room, took her in the treatment room, and then, you triaged her, you just got her chief complaint, did vitals?
Chief complaint, vitals. I believe the doc came in and kind of did a quick assessment in the triage room before we moved her back to a treatment room. Then from there we gave her some pain medication. She started feeling a little better, and then she said she needed to go have a bowel movement, and that's kind of when the whole thing happened.
So what did you do after that? So when she went to do the bowel movement, where were you at?
Initially, I was at the nurse's station, and then at some point I went and kind of checked on her, knocked on the door, seeing if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Flush, toilet flush?
Yes, after a while I started hearing, so I probably checked on her 2 to 3 times, I'm not exactly sure, and then I just kept hearing paper towel dispenser, and flushing and the water running, and I knocked again, did she need anything, denied anything, and then eventually it got to a point where I said, you need to come out, and I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that
She
point?
didn't say anything. She was just looking kind of straight past me and went back to the room.
Did you look into the restroom?
I did.
Okay.
Yeah,
What did you see?
Went into the restroom and I saw a large amount of blood.
Where
And
at?
it was on the floor. It appeared to, she had tried to wipe it up in places. It was kind of on the back wall behind the commode, the toilet. And so I said, you okay? What happened? And she said, I'm on my period, what she said. And she walked out. And then I went in, because at this point we had already received the positive pregnancy lab test.
When was that?
I couldn't tell you the exact time, but I know prior to that, we got a positive pregnancy test on her.
Okay, prior to the bowel movement, did you tell her that y'all got a positive?
No, the doc hadn't been in there to tell her yet.
Okay,
Yeah, so went in there, and I did look into the trash can at that time to see if there had been anything tossed, but the liner was fresh and completely empty. I didn't pick up the can, obviously I would have known, but I just looked in the can and there was nothing in there. It was a fresh liner.
so there's no trash in the
There was
liner?
nothing in there, yeah.
Do you know if they keep fresh liners? Because I know some places they put
Yeah, there's usually
new
like a
liners
roll.
in the bottom of the
Yeah.
trash can, and then they put the liner in and
Exactly.
then take the trash out.
Right, that way when they change it, they can just put a fresh one in. So yeah, there's usually a roll or a bunch of extra liners at the bottom of the trash can.
So you said there was blood on the floor, and it looked like some parts of it looked like it had been
Right, it looked like it had been wiped up.
well. And you said on the wall. Was there any on the toilet?
I think there might have been some at the bottom of the toilet. I don't remember if there was some on the actual seat.
Okay.
No,
All right, and then so the doc hadn't told her that she had popped.
not yet.
So like, because speaking with Vasquez, she said that, and don't quote me on this, but like y'all did a urine and then a blood.
But, right, so typically they'll do a urine and that just tells you negative, positive. And then they do the blood, it kind of gives them a range of how far along.
So
how far along she
did
is.
the urine come back after as well, or so did all of it come back
It
after
probably-
she came back?
It probably all came back before
Okay,
the
but the doctor would be the one to tell
yeah,
her.
the doctor would be
Okay.
the one to go into the room and tell her. And after she came out of the restroom, that's when she went in to do a vaginal exam. Obviously, we didn't know what this blood was from. We were a little concerned that maybe she had known that we were gonna figure it out and that she might have harmed herself or something in the restroom. So the doc wanted to go check her, but obviously that wasn't the case.
And how long have you been working here?
Here, about 5 years.
Okay.
Yeah.
So during your time, if someone were to pull the emergency cord have you been here when somebody's
Oh,
pulled that?
Yeah. For
So
the restroom
somebody-
specifically.
Right. So if somebody pulled that cord, y'all would have known.
Oh yeah. The restrooms typically at every facility will give a different chime than a room, like a room call bell.
Right.
It's like more of an urgent chime, I guess you would say. Yeah, just so that way everyone knows it's not just your normal.
Right. And to your knowledge, that alarm never went off.
That alarm never went off.
Okay.
No.
So then what occurred?
So after that, her and the patient went back to the room. The physician and a female nurse went in to do the vaginal exam just to make sure everything was good there. I believe I wasn't in the room, but I believe that's when the doctor said, "Hey, your test came back positive for pregnancy." She adamantly denied it up to that point, even with me the entire time. She said she was a virgin. She's had her period every month consistently. So the doc was doing that.
Then you said that, and she told you that when you were
She
triaging.
told me that in triage,
Okay,
yeah,
okay.
that she was a virgin and that she had her last pregnancy was just prior on that month and had.
You mean period? Because
Yeah,
you
sorry,
said pregnancy.
I'm sorry, yeah. Her period, she had them consistently every month. So then I started doing my charting, and then we called in the housekeeper to clean the restroom. We call it like a terminal clean, just when it needs to be mopped and everything. And then she felt the weight in the wastebasket, and then that's when we found the baby, and then moved it into the trauma tube. And
Did you find the baby? Did you see the baby
I saw the baby
in the trash can, or
in the trash can. HT, he was there. He's another nurse, and Leela, she's the housekeeper. They initially found it, and I went over there and saw what they had.
and what exactly did you see when you looked in the trash can?
I saw, I think at that point they had already ripped the bag, but it was just laying, you know, at the base of the trash can under the liner that they had pulled up. And there was like some paper towels in that bag with the baby. And then we moved it over and took it out, put it on the bed, on the stretcher.
So HT and Leela found that you were. So
Yeah.
what made you go to them? Did they tell you something, or did you just go?
I believe Leela basically called out for HT, I think, and then he went over there, and then I went over there as well.
Okay, you
after
you
him.
went to go see what happened.
Right, to see
Okay.
what, because typically if someone's calling out in the ER, it's not
Bad.
good. Yeah, it's usually not good. But
Well, you said you've been working here 5 years, so
yeah, I've worked here about 5 years.
so you're already prepped for something bad.
Well, not necessarily like this. This is definitely unusual for us, but yeah, for bad stuff. If you hear someone kind of calling out, you always go check to see if they need help, basically.
And could you tell if the baby was alive or
They did
Passed.
not look alive.
They did look
did
alive.
not look alive. They looked. But also, I think the time had passed since she left the bathroom and it being in the bag. You know, it was just
how long do you think that was?
maybe like 10 or 15 minutes. I just have a
Right.
guess. I don't know. I'll have to look at
And did after the doctor went in and told her she was pregnant, did you have any other contact with her after that?
with the patient.
Mm-hmm.
I might have went in to have her sign some paperwork, but that was probably
That was it.
we had to transfer her
Okay.
to get OB care and post.
Okay.
Did you have any contact with the baby after that?
All we did, we brought the baby up. We called the doctor, obviously, out of the room from her exam, and we came in, kind of, doc assessed the baby, and basically determined it was not viable to completely work the baby and all of that. So that was about the extent of it.
Okay. So and then your last contact was doing paperwork to transfer her out?
Yeah.
Okay. Do you know of anybody else that would have had contact with her that we should talk to?
Marina Perez, she was the house supervisor, and that's probably about it.
What does she do?
She came in and I don't exactly remember. She had a form of paperwork that she was helping fill out with.
Oh, so
the
she was filling
patient.
out paperwork.
Yeah, with
Okay.
with the patient.
Did you see anything in the hallway? Any type of blood droplets or blood from the bathroom to the trauma room? Did you see anything?
I believe there was like maybe from footprints or something. There might have been blood coming from the restroom to the back to her room.
Okay.
All right. Is there anything you think we should know about that we haven't asked?
Not necessarily not like factual things. Just it
Yeah,
seemed like we were being just deceived from the beginning. But that's just my take on it. It seemed like she was very manipulative with us. And
What did she appear like when she came in?
she
I mean, could you because I know most women you can tell unless they're a large woman.
right.
She's a petite girl. Could you tell that maybe she was pregnant or?
I could not. She was very what would be the word? Not necessarily standoffish, but anytime you asked her to lay down, she would kind of maneuver away from you almost. It seemed like, thinking back, she wouldn't want you to kind of. It was at least what it seemed like to me. She didn't want you to discover, that she was pregnant, and she wore really baggy clothing. And she wouldn't sit still for you. I'm sure she was very uncomfortable too, but yeah, she wouldn't allow you to do it.
All right. Can we get a?
Hello.
Oh Lord!
Is that a bad thing? I'm Marina.
I've met you before.
I have seen you lots of
I
times.
met you too.
So Detective Gonzalez, Corporal Mentor, Detective Mentor.
Okay.
So we're just talking to you about the incident that happened on January 27th.
Okay.
Can you just tell us from the beginning of your contact with the patient or the baby, from last
The
contact with
incident?
either? Yes.
Okay. So I was up at the medical floor, and the ER tech had called and said, the doctor wants you to call in the on-call lady for the ultrasound. So I'm like, okay. So I called in the ultrasound tech, and then I don't know how much time lapsed, I don't know, that the house supervisor phone rang again, and it was the girl from the lab, and she's like, Marina, they need you here in the ER right now. And I was like, okay, what's going on? Because I had noticed the ER board on the computer, there was like maybe 2 or 3 patients in the ER, I'm not sure. And she's like, well, and I'm like, it's okay. I could just tell by her voice something was wrong. So we hang up, and I take off to the ER. And as I'm coming in through the radiology department into the ER, I meet up with Lori and HT, who was the charge nurse that night. And HT says, okay, look, this is what's happened. This girl came in with abdominal pain, and once we put her in a room, she said she needed to go to the bathroom. We let her go to the bathroom, and she was there for a good while. They had several attempts to knock on the door and ask her, hey, are you okay? Do you need any help? And she said no. She was okay. And so I guess they felt like she was in there for too long. So they were like, hey, you need to come out. They went to get the little key that could open the door. And, excuse me. So I guess when they opened the door, they saw that she was cleaning. She was trying to clean blood. They said it was a horrible, gory, bloody mess in that bathroom. I did not see that. So then they walked her back, I guess, to her room, which was ER room 2. They walked her back to the room, and at this time we still didn't know that there was a baby. So they said that they went back into the ER room 2, and I guess they reported to the doctor saying, hey, here's all this blood, like something's going on. And of course, you start thinking of like, what if she tried to do this? What if she tried to do that? Like, they didn't know. So then the ultrasound tech still hadn't got to the hospital at that time yet. So the doctor's like, you know what, I need to probably do like a pelvic exam to look, because like, what's going on? Why is there so much blood? So the charge nurse HT says that, they were in the room and probably trying to set up for the pelvic exam when Lori, the ER tech, had already called Leela, the housekeeper. Hey, can you come and clean this bathroom? Because there's a lot of blood. So Leela went to clean, and she had already been cleaning pretty much everything when they said that the last thing that she lifted the trash can, and she realized that it was heavy. And so then she was like, like, this is weird, because this bathroom trash has never been heavy. So she said that when she looked, that she wasn't sure what it was, but she kind of thought that what she was seeing was maybe like a baby. So she said that she yelled out for Lori, and Lori went in there and grabbed it, and I guess sure enough realized that there was a baby in there. So Lori yelled out for HT, or went to get HT. I'm not sure exactly.
Were you at the nurse's station at this point?
No, they still had not told me about that, because they didn't know that there was a baby. So I was still at the medical floor.
Okay.
And so then HT, when he's telling me this story, HT tells me that he goes, grabs the trash can, and he lifts the bag, realizes there's a baby in there, so he takes it right across the hall to trauma 2, tears open the bag, realizes the baby's there, and it was
you
lifeless.
didn't witness any of this?
So at the time, he's telling me that, so he's like, so come on. He's telling me everything I just said is from HT's story.
Okay.
And so then he's like, so come on, here it is. And so I walk into the trauma 2 room, and sure enough, the baby's on the gurney where he had placed the baby, lifeless. And the trash can is right by the gurney. So, like, of course, I was in utter shock. Like, you know, we were all just in shock. And so they had already called the police. The doctor, I think initially at the time, was about to do a pelvic exam to look to see where all this blood was coming from. And HT had gone and told her, hey, I need you right now, like, you need to come with me. And took her to trauma 2, showed her what had happened.
And were you
so,
still in trauma 2?
So, no. So that happened like before.
Oh, okay.
That happened before I got there. So then when HT told me all of that, when I came out of trauma 2, HT and Dr. Vasquez, and the authorities, the police officers that were just getting there, and I know that Dr. Vasquez went and HT went out, like, to that little area inside the hospital, but like where the ambulance comes in, and they kind of were giving the police like a heads up of what had happened. So then after that, I really didn't know what happened, because I was on the phone with my chain of command, because I needed to know, like, you know, this has never happened. I didn't, as a house supervisor, I didn't know what I needed to do, if there was any paperwork that I needed to do, if we were supposed to register this lifeless body. Like, I didn't know. So
you called your chain of command, like, for
called-
guidance?
I called, yeah, for questioning. So I called Patty, who's the CNO, Patty Bartok, and I called her and I said, hey, look, this is what's going on, and I need to know what I need to do for legal purposes. And so she was like, well, Marina, you know, like, I don't really know. Let me have you call Cindy Buck, Cindy Buck is like in charge of medical records, and she deals a lot with the birth certificates or death certificates. And so she said, so why don't you call her, and then I'll get legal on the team, you know, on the phone, and see if I can find out what needs to be done. So, but then after that, like, I was on the phone with Cindy, and then after that, like, Patty was calling me, and then all of administration basically were calling me, like,
And is that your job?
That's my
Like,
job.
That's your job.
Yeah, as a house supervisor, like, I'm in kind of charge of, like, everything that happens during the night in this facility. And so, and even Dr. Salgado called me and was wanting to see what had happened, and he told me that he was awake, he was already planning on coming in, you know, to speak to the doctor. And so Cindy Buck actually had told me, okay, like, yes, we need to register the baby, and like, as a, you know, like a Jane Doe or whatever, like infant male, but there's also like a paper that I need you to, you know, ask her. There's a paper that you need to ask her, and the nurses fill out. And it's very important that you, that we know whether or not the baby took a breath or whether or not the baby did not take a breath. And I said, okay, well, so at that time I said, because every nurse by that time had been telling me that this patient had been kind of changing up little bits and pieces of her story while she was in the presence of her mom, I guess. So when I said, okay, I'll try to, you know, get the truth out of her, then Cindy was like, well, whether you have to ask the mother to leave the room, but we need to know. Mm-hmm. So I went and I found the form that Cindy was talking about, and I go into the patient's room and I introduce myself, and I said, there's just a few questions that I need to ask you, and most of it was like, you know, first and last name, date of birth, social security number, which she didn't know, and then whether or not she knew whether or not she took any kind of medications. And then, so I said, so, you know, right now it's very important that you're very honest and truthful with me. I said, and it was just she and I in the room. And
Mom wasn't there?
Mom was not there.
Okay.
And I said, did your baby take at least one breath when it first happened? Or did it take at least one breath, or was it not breathing? And then she kind of looked at me in the face and the eyes, and she was like, well, can I tell you? And I said, tell me what? And she said, so I've been having this bad abdominal pain, she said, and we came here to the ER, and when they brought me back here to this room, I felt like I needed to go poop. She said, and I asked if I could go to the bathroom. She said, and so when they said, yeah, that I could go to the bathroom, she said, when I sat on the toilet, she said it just all fell out. And she said, but when I had it in my arms, it wasn't breathing, it wasn't moving. And so, of course, you want to be very, very judgmental at that time, and you have to bite your tongue sometimes, but, you know, my first reaction was like, I wanted to say, hey, well, then why wouldn't you call us for help? But I didn't. She said, so I just, he wasn't moving, he wasn't breathing, so I just placed him in there.
Was that the last contact
And
you had with her?
Then, so then I asked, so do you have, was it a steady boyfriend? She said yes. And then I said, did he know that you were pregnant? And she was like, no. I said, did you know that you were pregnant? And she said, no. And then I said, so do you want to include him, because there was a section for like the birth certificate, and I said, so do you want to put his name down as the father? And she said, for what? And I said, you know, this is all new to me too, so this would probably be for the birth certificate as well as a death certificate. And she said no, that she didn't want to put him down. And I said, okay. So I think she had to sign it. And she signed it, and then that was it. That was the only contact that I had with her. And then, of course, they were transferring her to Roswell to be seen by an actual OBGYN doctor. But that because after that, I was just on the phone with my administration team.
Because you're in charge of like the whole operation, so you just had to make sure everything was flowing.
Yeah.
Okay.
Yeah. I had to make sure that if there was paperwork that needed to be signed or filled out, that I needed to make sure that that was done before she got transferred out.
Okay, so you just handled her paperwork before she got transferred out. So you said, how long have you've been here a while?
Yeah, I've been here at this hospital for 23 years.
Oh.
Yeah.
Going back to when you were talking to her and she said it wasn't breathing,
Yeah.
and did she say, I just placed it in the trash? Or
She just
what?
said, I didn't know what to do. She said, I didn't know what to do, so, I mean, and I don't even really, to be completely honest, I don't know if that was her wording, that she placed it in there. I don't know, I don't remember her wording, but I just know that she said it just all came out, and she had it in her hands, and that she didn't know what to do. She didn't know what to do at the time, and so I'm like, I don't want to say that she said that she placed it because I don't remember.
That's okay. You don't have to.
That's fine. That's fine.
So, other than what we asked you, is there anything else we didn't ask that you think we should know?
Not that I'm aware of, I don't
Okay.
think.
All right. Well, if you have any other things that you like tomorrow, you're like, oh, I forgot to tell them this. Cynthia has my contact information, so you
Okay.
can let her know.
Okay,
And that's Minster's contact information.
okay.
If you have any more questions, comments, anything you want to add, okay?
Okay,
Thank you for
sounds
coming
good.
in.
You're
Thanks,
welcome.
guys.
Thank
Appreciate
you.
you.
You're welcome. Thank you, guys.